Uh, Hello, everyone. We've got Dr. Sundeep Manot with us. Sandeep has a very interesting story. Recently, he has passed his AMC exam, and given it's 2025 now, and I passed my exams quite a while ago. I thought we'll get somebody new and fresh who has recently done the exam in the process of the job hunt to share his experience, particularly regarding the AMC exams and his way of how he got through it. Sandeep, thank you very much for joining us at very short notice, and I appreciate you reaching out to me. I am very glad that you have agreed to give us a bit of an interview. So tell us a little bit about yourself.
Thank you, sir. Thank you for having me. It's a privilege to be on your channel. Hey guys, my name is Sandeep. I'm from India. Passed my exam. I did my bachelor's from Russia actually. Passed out in 2009, and then moved back to my home country. Worked there for about 5 6 years. Did a PG diploma in family medicine. Um, I was a part of research team over there, and that's where I actually worked with some of the public health researcher over there, and I wanted to study more, and then they recommended me to try for Australia actually to study public health. So I moved to Australia in 2019, studied public health, got my research internship at University of Melbourne when I was studying, got a research intern position soon afterwards, uh, and then transitioned towards teaching at Monash University. So currently I'm teaching for Department of Physiology and Public Health at Monash University for past 2 years. But after a while, it seems that I was missing the clinical part actually. So I thought, okay, I'll prepare for my AMC exam. Did all the epic verification and everything. Um, Set an exam um, in September last year, and cleared the exam. So yeah, it's been a roller coaster ride for me.
Yeah, so that's incredible. Like after such a big gap, you got the motivation to do the exam. Tell us a bit about your motivation, what prompted you, and then how did you prepare for the whole journey?
so so it I so when I came to study public health here, I I had no intention to stay here. Actually, I just wanted to complete my studies and go back. But actually, after a while, I started to like the what's on offer here, like better lifestyle and better wages. So I fell in love with Melbourne actually, and then I thought, okay, I'll give it a try and try to prepare for AMC Step One. And I had no clue how to start that, and that's when I actually found your channel on YouTube. Got I mean, your story was very inspiring to me, and got all the information which was required for me to start my journey. So, yeah, I mean, after being away from clinical medicine for about 5 years or so, I started to feel that I'm missing something, and I felt that okay, maybe this is the time to get back to clinicals again. So that was the main motivation for me.
Brilliant. Now, for somebody who has been in the same sort of a journey where they've been away from clinical stuff or they've still been in clinical stuff, but they're trying to start the AMC exam journey, how would you guide them about preparation, what they need to do, and how they should start preparing for it?
I mean, for me, it was bit challenging initially because I'm already having a good permanent job at Monash University. I mean, I don't see any other reason to move to a different suddenly to the clinical part. But it's just that I was really missing after a while when day to day journey. You kind of, I mean, at least for me, I felt like I'm missing the clinical part a lot, especially the procedural part. So and then I was not sure whether I wanted to give it or not, but that's where my wife came up, and she was the biggest supporter for me, and she pushed me a lot. I decided not to pursue it, but she was like, if you're missing clinicals, why don't you go for it? What words would happen? Like, you might give it for 2 or 3 times. That's fine. Um, you know, keep pushing yourself. And yeah, she was the big. She's the biggest supporter for me. And
Behind every successful man, there is a woman.
yes, that is absolutely true. So what we did that she came here once I finished my study. She's an RN, so I was working and she prepared for her exam, and I was taking care of everything. And once she cleared her exam, she told me that now everything is settled for me. So now this is your time to get back to your study, take some time off, study well, give your exam, and then move forward. So that's how we did it. So
So,
I could
what
have.
resources did you use for your exam? What did you study, and how long till from the way time you started till you gave the exam?
So I was. I mean, online, when you search about different study material, there is a lot of shady information. Like sometimes you get something good, sometimes it's not good. So it's just that I was really struggling to find a good guidance. And that's when I actually found your video on YouTube, and you talked about John Murtagh and other book. And the book which really helped me was this one, Clinical Assessment. I think this is the book which gave. I think this is the book which gave me a little bit of edge, because usually we don't study this book, but this, because I've been away from practice for quite some time. So I think uh, this book gave me a very good idea about how to tackle the questions, and how they used to, or how they like to ask questions. Um, Many of my seniors who previously gave that exam, they told me to go, and check for all the previous recall. Um, I think recalls are good, but it's just that they can change the recall anytime. They can tweak the question here and there, and the entire answer will be changed. So it's just that if your foundation is really good, then doing recall maybe in the last moment might be okay with that. But initially, I made my own notes, followed John Murtagh, read a couple of Kaplan books, and this clinical assessment, which really helped me to pass my exam actually.
How did you figure out to read the clinical assessment book? Most people do it in for AMC too. What made you decide to do that?
Actually you mentioned about this book in your video, in your preparation video. You mentioned about this book, and I thought, okay, I'll give it a try. So I mean, this is a very different kind of book, because obviously it's more towards the clinical step 2 or the clinical side. But this book really gives you the insight about how the questions are prepared and how to answer them. So I think this book not only helped me to pass step 1, but this is also helping me right now to prepare for step 2.
Yeah, well
So
done on doing that. I think for me it sort of made sense, because if, as you said, if the MCQ they change the question a little bit from one
yes,
thing to another, then you sort of get confused if you've only done recalls and your information is limited. But if you
true, true.
expand on things, and there are only a few topics in medicine that are repeatedly asked, like chest pain, they have to ask chest pain.
Yes,
They'll have to ask about pneumonia. They'll have to ask about stroke. Those are common things, and abdominal pain and things along those lines, a rash in a kid,
yes,
meningitis, and those sort of things. And I think this book actually gives you a really good rationale. And if you can understand and read and learn about those 100 common conditions, then you're
yes,
most likely to get at least 50% of the marks in the exam. And that's all you really need to do. For the exam, you don't need to score 100 out of 100. You only need to score 50%.
true. That's true. That's true. I mean,
Yeah.
when I did this book, I was like, okay, there's too much information, but uh, I made my notes, and I used to study whenever I can, after work or on weekends, and this really helped me to prepare much better actually.
Good. And then where did you practice your MCQs?
So for MCQs, I used Amadex actually, and I joined the Facebook Amadex community where they keep on post new questions, and uh, I didn't had time to go through all of them, but whenever I can, I used to just go through some random questions just to have an idea that what kind of questions they are currently asking. In my opinion, I mean, when I gave the exam, I think I found a lot of questions from ethics and psychiatry. So I think this was, I mean, some of my seniors, they advised me to prepare well for ethics and psychiatry, because lately there have been a lot of questions from these two particular subjects.
Did
But
you prepare any particular book for ethics? There used to be 100 ethics questions book
yes,
in the
yes,
day.
yes, yes. That's the same one, and there is one more. There is one more book of Kaplan actually. Uh, I don't. I think. Uh,
That's all good.
yeah.
What we can do is put it in the caption later on at the end of the video. Once we've got all the names, and we'll put the links down. For psychiatry, how did you prepare for that, and what resources did you use?
So I actually joined a coaching when I was preparing. The coaching called as Emergency Focus, and the coaching was for about 3 months or so, and they provided psychiatry material and RSCGP guidelines. So I just prepared from that, and I think that was I mean, they pretty much covered everything in that. So I didn't study anything extra for psychiatry. Whatever
Very
material
good.
was really useful actually.
Useful for you. All right, excellent. And then, in terms of total study time from start to finish, how long did it take you?
Actually, I studied for about 6 months, little over 6.5 months.
Mhm.
Initially, I think first 2-3 weeks were little challenging for me, because I was really out of uh, the study zone, so it took me a while to build my schedule. But after 3 weeks or so, I used to come home around six something, and then join classes. Like classes was like every alternate days. So if there are no classes, so I'll study for about 3 hours or 4 hours a day, and on weekends I used to study about maybe 6 or 7 hours a day.
Yeah, I
So
think that's perfect. Like anything more than 3, 4 hours, and you sort of don't absorb
yeah,
things and don't
I,
keep it. There's no point.
yes, I lose
There's so
my.
many things. Yeah.
So,
Excellent. Now, for somebody who is doing the exam for the first time, any sort of things that you learn and you feel that are really important? You mentioned about the AMC book, you mentioned about the ethics and the psychiatry. Any other
yeah.
resources that you would like to point them to?
I uh, I took Amedex subscription, um, apart from the resources, and then last 1 week I took a subscription for 1 week from. There is one more subscription called as Amboss, if I'm not
And
wrong.
Boston. Yes.
Yes. So I did a little bit of practice from Amboss too. There are quite a few mock exam softwares available. You know, GP Pass and Medical Expert. So they have free mock test available, and I gave mock test for about, I think, 4 or 5 days continuously. So that really helped me. And then what I did, this is I usually don't do, but what I did, because I'm based at Ballarat, so I have to travel from Ballarat to Monash. It's about 2 hours
Yeah.
journey. So what I did, whatever notes I made, I made a audio file for that, and when I'm traveling, I listen to those audio files instead of scrolling through your social media and all. So
Ah,
I think that really worked for me. I mean, some of the questions were really straightforward for me. So I was just, okay, I heard this. It was in my audio file. So I clicked it. So in that way, that really helped me. And I think, I mean, nowadays, I personally prefer to write my notes because that helped me to memorize it much better. And I'll try to make diagrams whenever I can because some complicated issues, um, I'll prefer to make diagrams because that helped me to visualize things much better. So yeah, that's pretty much
How
it.
did you make the audio files? I'm quite interested. That's a new technology thing.
So it's just that I used to drive previously, but then I thought, okay, I'll take the public transport, and public transport takes about 2.5 hours. So I thought, okay, what I'm going to do during this time, and because I've already, and in my backpack I already have my books and laptop and everything, so it's already too heavy, and I cannot carry this book all the time. So I thought. Uh, so, like before going to bed, I used to revise things like maybe 30, 40 minutes just before going to bed. So I thought, okay, I'll read it out loud and I'll record those things to my phone. So next day, what I'll do when I'm traveling, I'll just listen to that thing. And that helps
Brilliant.
me to, memorize things in some.
You're talking like a true academic. Well done on using those skills.
Yeah, desperate time, desperate measures, I guess.
Well done. Look, I wish you all the best for your journey ahead for AMC2 and getting into the clinical system. Looking forward to being a part of your journey and helping you get into the system. And I think you'll make a brilliant doctor. You've got some innovative ideas and you've got some great insight, and you've done really well. So I wish you all the very best, Sandeep.
Thank you so much, sir. Thank you. Thank you for having me.